and we're going to chat about the anatomy of the pectoral girdle, pelvic girdle, and then anatomy of the leg. So let's start with the pelvic girdle. This is the entire pelvis, which consists of 3 bones. You have 2 coxal bones, here and here, and you have sacrum with a coccyx, but coccyx is broken off here, so it doesn't matter. So sacrum and 2 coxal bones form sacroiliac joint right here. Okay? Now let's talk about coxal bones. So this is an individual coxal bone. This is the surface that forms sacroiliac joint. Coxal bone can be divided into 3 parts. Ilium, which you can actually feel in your hips. Ischium, like when you land on your butt, like really badly, and there are 2 bones in your buttocks that hurt, And pubis, the anterior portion, that you can feel if you press on the groin. Okay? There are several features that will come in handy later, like maybe in AP2. Well, acetabulum will come in handy in a minute. This is the depression that articulates with the femoral head, okay, head of the femur. So on Benjamin you can see the articulation right here. This, the hip joint. Obturator foramen. A whole bunch of blood vessels and nerves and even muscles go through that foramen here. A pretty large ischial tuberosity. Blunt process, blunt protection, the site of muscle attachment. Here you can see a couple of greater, sometimes I'm blinking on the words, greater and lesser sciatic notches provide some space for nerves and blood vessels. Okay? Now pectoral girdle, pelvic girdle, provides the site of attachment for your lower limbs. And just like with the upper limbs, you have 3 big bones. I'm not counting patella, it's not a big bone. 3 big bones in the leg. The femur, okay, this is the right femur. So the bone of the upper leg, the only bone of the upper leg, is the biggest and the longest bone in the human body, the strongest bone in the human body. Theoretically, it can withstand the compression up to 2 tons. Okay. So prominent features include the head, the neck. In elderly people, femoral neck is one of the most frequent sites for fractures caused by osteoporosis. On the posterior aspect of the femur, you can see that it's a posterior aspect. There are 2 trochanters, greater and lesser, sites of the muscle attachment. Anytime you see a projection, it's a site of a muscle attachment. The distal end of the femur, you can see 2 condyles. Well, this is broken up. Let me move another femur. Better, still not ideal. So you can see 2 condyles and 2 epicondyles, medial and lateral. So sites of muscle attachment are on the epicondyles, while condyles of the femur articulate with the condyles of tibia. Tibia, the bone in the lower leg, is the only bone in the lower leg that bears weight. Okay, does that make sense? Fibula, the lateral bone of the lower leg, shown here, does not bear any weight at all. Its function is to provide the site of attachment for various muscles of the lower leg. So there are examples of people fracturing fibula and still being able to walk. Okay, you can do that with the tibia. A couple of prominent features, basically the only features on the fibula and the tibia that I want you to really know. The medial malleolus of the tibia is an attachment site for muscles of the foot. It's a projection. Lateral malleolus is the same as attachment site for the muscles on the fibula. So projection, something like that. Okay. So you can see them here in Benjamin, kind of. So you can see medial malleolus here and lateral malleolus on the fibula here. That makes sense. Now, both tibia and fibula articulate with the tarsal bones in the foot. Now it's time to talk about the foot. And we're going to first get phalanges and metatarsals out of our way. Just like in the hand. In the foot, you're going to find 14 phalanges. They are numbered from the big toe to the pinky toe. Does that make sense? So 1, 2, 3, 4, 5. Just like in the hand, your toe, the big toe, has only 2 phalanges, proximal and distal, while all other toes have 3, proximal, medial, and distal. That's 14 bones, technically speaking 28, because you have 2 feet out of the way, right? These 5 bones, called metatarsals, just like metacarpals in the hand. Common confusion. Tarsals are confused with metatarsals. Carpals are confused with metacarpals. Don't do it in the naming, okay? So, 5 metatarsals. Now what about the bones, what about the tarsal bones? The bones of the dorsal aspect of your foot. So this big bone right here is calcaneal bone, or calcaneus. That's the heel bone. Right on top of it, here, is talus. Basically, you can see that talus here is the bone that fibula and tibia articulate with in your ankle. So calcaneus and talus are usually not a problem for the identification. So far we good? Now what about others? I don't have any good mnemonic rule for them. I usually do this. Come closer. So calcaneus starts with C. The bone it articulates with also starts with C. This is cuboidal. So calcaneus and cuboidal. Calcaneus and cuboidal both start with C. Kind of way to remember them. Does that make sense? Here you have talus, and it articulates with a bone called navicular. So the first letters form TN, which is the acronym for the state of Tennessee. I mean, it's a stupid rule, but usually stupid rules are the best ones to remember. So again, calcaneus, cuboid, talus, and navicular. What about these 3 bones? Those are wedge-shaped bones called cuneiform bones. So you have three cuneiform bones. They go from medial cuneiform to intermediate cuneiform to lateral cuneiform. So since your big toe is medial, so medial cuneiform articulates with first metatarsal. Intermediate cuneiform articulates with a second metatarsal. And lateral cuneiform articulates with a third metatarsal. Does that make sense?